Public options have been around in conversations about healthcare reform in America for a while now, and a public option was originally supposed to be a part of the Affordable Care Act.
But an additional step we can take to keep insurance companies honest is by making a not-for-profit public option available in the insurance exchange.
These plans are proposed as ways to reduce the cost of healthcare and increase rates of coverage. Public options are essentially government-run or authorized health insurance programs that are available on the health insurance marketplace and compete alongside private health insurance. The idea is that by running the plan as a nonprofit with set price targets, it can be more affordable and then induce private insurance to also become more affordable to stay competitive. The public option was cut from the Affordable Care Act, but a variety of states have passed their own versions of a public option plan. Washington was the first state in the country to implement a public option style plan, and now Colorado has one, Nevada is in the process of implementing one, and some other states are considering following suit. Washington's public option is called Cascade Select. Cascade Select is really more of a public-private partnership than a true government-run public option. It's the product of a 2019 bill that created Cascade Care, which authorized various state agencies to collaborate and create a standard benefit structure for health insurance plans. Cascade Care also authorized the Washington State Healthcare Authority to set up a public option style plan that would be offered by private insurance carriers. The way that Cascade Select was designed to work was that private insurance carriers would choose to participate, and alongside their individual plans would offer a Cascade Select plan, which would be the public option. Provider participation to accept coverage from these Cascade Select plans was initially completely voluntary, which we will come back to later. The vision for Cascade Select was that it would offer insurance to Washingtonians who don't have insurance, who make up 6.3% of the state's population. It was also intended to reduce out-of-pocket costs. One way to try to increase affordability is a reimbursement cap. For the Cascade Select plan, aggregate provider reimbursement would be capped at 160% of Medicare's rate. What does this mean in practice? Let's say you're covered by Cascade Select and you get sick or hurt and need to go to the doctor. Let's say the treatment requires you to make 2 trips to get the same procedure twice. The procedure you get has a list price of $1,000. For this particular procedure, let's say Medicare reimburses $500 each. The reimbursement cap means that the average of all the reimbursements to the doctor or provider for this procedure can only be at maximum 160% of what Medicare would pay. In this case, that's $800, and over 2 visits, that totals $1,600. But the aggregate requirement means that individual reimbursements can vary. One treatment reimbursement can be $700, and another might be $900, as long as that average is below that number of 160% of what Medicare would pay. The intent with lowering the reimbursement amount is that what is saved is passed down to consumers as lower premiums and other out-of-pocket costs. For context, Washingtonians with private insurance see their carriers pay 174% of Medicare's reimbursement rate. The initial goal was simply to match Medicare's rate 100%, but due to fear of provider pushback, policymakers ended up compromising with the 160% number. Due to similar concerns, there are other requirements aimed at incentivizing provider participation. One such requirement is that for hospitals acting as the sole provider for a community, which is common in rural areas, provider reimbursement has a floor of 101% of what Medicare's reimbursement rate would be. So in contrast to the previous reimbursement cap, a reimbursement floor means that under no circumstances is the carrier supposed to pay equal or less than Medicare's rate. In a similar vein, for all primary care services, provider reimbursement has a floor of 135% of Medicare's rate. The intent for these reimbursement floor requirements is to motivate providers to participate in the Cascade Select plan without concerns about compromising their revenue, especially if they serve underserved communities. The fact that participation in Cascade Select plans was optional proved to be a barrier, especially early on with the COVID-19 pandemic and a strained healthcare system. Washington passed another bill in 2021 to require each county in Washington to have at least one hospital partnered with an insurance carrier offering Cascade Select. The Washington State Healthcare Authority reports that starting in 2025, 100% of Washington residents will have access to at least one Cascade Select plan on the Washington Health Plan Finder website, which is Washington State's healthcare marketplace. Washington's public option style plan will be an interesting case study in years to come, especially when it can be compared to the other public option style plans that different states are pursuing.